This is Module 4, Accepting Responsibility. I'm here with Miss Matthews. And so, Jessica, I wanted you to list 4 obstacles that always stand in your way and prevent you from keeping weight off. Some examples: frequent eating out events, work-related eating, fear of sexual intimacy, eating as a sole source of pleasure, eating to reduce boredom, eating to relieve stress.
I'd say definitely having intimacy with a partner, and then eating to reduce boredom and eating to relieve stress.
It turns out that many patients who I see have that same issue. And, there's a very good chance, which we could certainly talk about later, that fear of sexual intimacy could have many causes, and one of them is women could feel uncomfortable with their bodies as a result of the weight and maybe not be as interested in having relations. Another possibility is childhood or adolescent or even adulthood sexual abuse. And this is something, if present, we should get you into proper counseling for, because it really does make it that much harder in the future to be successful with keeping off weight. There are therapists who specialize in this, and we definitely should get you in with one. Some of your other answers: eating to reduce boredom. It's really important that we get you eating to live and not living to eat. And so many people eat for recreation, and it just becomes kind of like a hobby for them. We don't want this. We really want you eating for meals, but not for fun. Of course, those meals could be fun, but you shouldn't be snacking throughout the day and just eating, every time you had a temptation. And you should try to use your experience on the low-calorie diet to come to terms with some of those triggers where you're having these urges to eat when you're not necessarily hungry and it's not necessarily mealtime. Question 2. I wanted to ask if you could list your 3 most important values from the following list. Now, these are things that define you. These are not, there's no right or wrong here, but I'm just going to try to see if maybe in the future I could possibly influence your values. So the list is marriage or other significant intimate relationship, spirituality, material possessions, children, health, work satisfaction, pleasure, power, sense of purpose, friendship, self-esteem, financial security, status, physical appearance, creativity, and intellectual stimulation.
At this point in time, I think I most value self-esteem as number 1, and then I guess for the future, marriage and children.
Okay, so those are all really important values, and what I'm hoping right now is if anyone ever asked you this question again, so often the patients that I see, they answer the exact same way that you did, unless they had a bout with cancer or they had a heart attack and survived. Then they always put health number 1. And most of us take our health for granted until we have an issue. And it turns out that nothing in the world will, get a person who's not healthy healthy. You can't buy health. It's just you're fortunate if you have it, but once you lose it, it's sometimes very difficult to obtain it again. And so why I think this is really important is your weight issue is a health issue. So if you really do care about your self-esteem, you probably would have really low self-esteem if you were unable to provide for yourself, if you couldn't take care of yourself. It's easy for you to gain weight. It's just like a diabetic has to watch what they eat. They can't have too many processed carbohydrates. They may have to inject themselves with insulin, and they do it because the doctor says it's necessary to stay healthy. In your case, you've been dealt a bad hand in life. You don't have the luxury of not paying attention to what you eat to remain at a normal weight. And this is just, what you've been given, and you have to pay attention to it if you want to stay healthy. And of course, your weight is a health issue. Your BMI is over 30, and it makes it so much easier if you associate the two, because now it's just not about food, but it's about being healthy. So, hopefully in the future, you'll see that as really important, and then you'll be able to tailor your life a little easier. So, great. And I will see you next week and next module.